Good afternoon. Thank you for joining us for our series in careers in kinesiology. Today we have Dr. Gail Bachman here with us. Dr. Bachman is a faculty member here on our campus, so I'm very excited to have her here. Thank you for being here.
Thank you so much.
Let's start a little bit about your kind of career path, how you started getting into kinesiology.
Yeah, so I did my undergraduate at San Diego State and originally was kind of on like a pre-med track, but then calculus, I was like, forget it. And I actually found I really liked more the application of some of the science courses that I was taking that were more kinesiology based. So I switched my major to be a bachelor's of science in kinesiology with an emphasis in rehabilitative sciences. And I think in my mind, I had the goal of going into physical therapy school. I became a aide. So I worked as a PT aide at a clinic out in El Cajon for like the last 2 years. I was in school to gain some experience, which I highly, highly recommend to anyone to really see if you actually like working in that environment. And then I graduated with my kinesiology degree and then took a couple years off, joined the Peace Corps for 3 years. I was a swim coach for a while. I was a substitute teacher for a while. And I just was kind of exploring, okay, I know I like being in healthcare, but what exactly avenue do I want to go? Do I want to do public health? Do I want to do teaching? Do I want to do physical therapy? And what I decided was actually the career of physical therapy could allow me to do all those things. So I knew that I could eventually be an educator if I wanted to. I knew that physical therapy has a very public health mindset. We think a lot about preventative health and health wellness overall rather than more of like a medical model of just treating or correcting problems. So I applied to a couple of physical therapy schools, one of which was San Diego State, but I had kind of thought like, oh, I've already been there. And then Sac State rejected me. And so I was like, I'm absolutely gonna become a PT. I'll show you Sac State. And I got into PT school at San Diego State in their first cohort. It was a brand new program for their doctoral program. So that was a 3-year program and yeah, completed it, got a job and then started teaching there about a year later in one of the labs. So I'm like a Aztec for life now.
Fantastic. Yeah. Awesome. Let's go back a little bit to your undergrad because there's so many people in our class here that are thinking, hey, PT is the way to go. I want to get into kinesiology. What would be some of your tips or advice for even the undergrad portion of your schooling?
Yeah, I think mostly you want to really find a topic that you're truly interested in. So like when you're taking the undergrad classes, especially some of those like 101 chem, bio, sometimes it can feel hard to like connect to the material. But really once you take those kind of more major specific courses, really decide like, is this interesting to you? Do you want to study this material? Because going into PT school, you're going to need to study just so much harder than you ever did in undergraduate. It's very shocking actually for a lot of students of how much work it takes to go through graduate school. So it's really first deciding, do I actually really like to learn about this? Because it's going to be an extra 3 years of just learning before you can really get into the job. So be innately curious. If you find you're not that curious about the topic and you're just doing the homework to do the homework, then you're probably not going to actually enjoy or be successful moving forward. Yeah. And then the other thing is gain experience during your undergrad as much as possible. San Diego State has a couple different things that undergraduate students can do, like volunteering in their research labs, which is a huge advantage because you get to know the instructors from the PT program that are running research. Right. They can write letters of recommendation for you. So volunteering in research labs, which I think even if you wanted to ask as a Mesa student and go over and talk to them, they might even allow volunteers outside of the SDSU. Right. And then like either working in a PT clinic or volunteering in PT clinics. There's also lots of nonprofits around the area, like Challenge Athletes Foundation, Life Rolls On, groups that work with adaptive athletes. And that's a great way to kind of see if you like working with people that are not typically moving individuals. So it's very, very different than working with someone in a gym setting where they are, mostly a well person and you're just trying to enhance that wellness. Working with people with disabilities takes a different kind of communication skill set and how you help them. So I think it's in the undergrad time, I would really explore like how much do you actually like this topic? Right. So you don't set yourself up for failure applying to grad school and just feeling like it's tough the whole way through.
Absolutely. Great advice. So right now you are multifaceted in your career, it sounds like. You're an educator. You also at one point were working in a private clinic, and you're also teaching at San Diego State in the doctorate program. Talk to us a little bit about the three prongs of education, how that helps your career, and what you enjoy most about your career now.
Yeah, so I definitely, almost from early on, always took like a multifaceted approach to my career. And that's just because I love this profession and I just like to do lots of different things. So first, when you graduate, you do need to learn how to be a clinician. Because most people, I know myself, you're kind of bad when you first graduate. You think, I've just gone to 7 years of school, I should be good at this. But that's not the case. It takes a while to just learn how to work with patients, how to really progress them, how to recognize deficits. And so I did have a first job that was in an acute rehab, working in their neuro, kind of the neuro setting, which was pretty intense, but it was a lot of learning. And then I got offered to be a lab assistant pretty soon after I graduated, but I felt like, okay, I'm starting to get a better handle on this. I definitely know I know more than when I was in that class. So I started teaching, and that actually enhanced my ability to be a treating clinician because I actually read my textbook because I wanted to make sure I knew all the answers for the students in class. And so I reviewed everything so much. And so I think that helped me become a better clinician because I was having to teach it, and then it kind of solidified everything because I was practicing. And so I kept up those, pretty much working full-time clinician and part-time faculty at San Diego State for about 7 years, and then became full-time faculty here. I've worked in a bunch of different settings as a clinician too. So I did rehab, I've done acute care, I've done outpatient, I've been in the emergency room. And I think hopping around to those different settings also allowed me to see kind of the whole spectrum of patient care, because it's very different what patients need when they come into the emergency room versus when they're an outpatient 6 months later. So that's helped with my teaching as well, because I've got examples from lots of different settings. Right now, I'm not working as a full-time clinician anywhere, but we do have a pro bono clinic on campus. So I treat patients out of that. And then I see some patients, I go down to Mexico with a couple of groups and treat down there, which is always fun because it's just like, we don't know what's going to walk in the door.
Absolutely. Fantastic. So in your journey, in your educational and then into your career journey, what kind of challenges or difficulties did you go through while you were growing up and going through this long process?
I think the biggest challenge first was when I got into PT school. It had been 5 years since I finished my undergraduate, and I had been in very, very different settings, life settings. I'd been in the Peace Corps and living in very rural areas. So it had been, when I went into graduate school, it had been 5 years in between when I had graduated and started grad school, and had been in very different types of situations that did enhance my learning as just life lessons, but wasn't a traditional school schedule. And that was a huge shift to go from being not a student back into and at a graduate student level, where it really is, yes, you have this time for your classes, but you really need to dedicate twice as much time outside of that. And the first real realization was our first anatomy test, which I had taken a very artistic approach to my studying and had gotten some sidewalk chalk out and had been drawing all over my sidewalk. I thought I had studied very well for this anatomy test, and I got an F on that anatomy test, which was the first F I had ever received in my academic career. And it was so shocking. And it was just that I was missing a lot of the specifics. So I had a good idea, I thought, but the specificity in which I needed to be studying anatomy and physiology was just so much more detailed than it had been in my undergrad and what I had been planning for. But the great thing was I had a lot of support within the class from other students, and I told people I'm struggling. That was really shocking. And I basically paired up with people that had just come out of undergrad, and they kind of told me their study tips again. And I did fine by the end of the semester. But it was really shocking how quickly you get out of that student routine and how much detail you have to study when you get into that graduate level.